You're watching WSTV Digital Media.
Of May 7th. There will be no meeting a week from today, which would be April 30th, and today, of course, is April 23rd. We're going to begin our meeting today with a roll call of the commissioners present, and I'll turn the meeting now over to our clerk, Ashley Sloop. Ms. Sloop.
Thank you, Mr. Chairman. Vice Chairman Martin.
I'm here.
Commissioner Elamine.
Present.
Commissioner Kaplan.
I'm here.
Commissioner Linville.
Ashley, I actually noted that he had left the meeting, probably inadvertently, but anyway, so you may want to call him last and see if he gets back in the meeting.
Sure. Commissioner McDaniel.
Present.
Commissioner Whisenhunt.
Present.
Okay. And we will check to see if Commissioner Linville rejoined. I saw him earlier. And that may take a few minutes. We'll let everyone know when Commissioner Linville joins.
Okay, thank you, Ms. Sloop. We have already seen Joshua Swift, who is the director of the Forsyth County Public Health Department. Nice necktie, but bow tie you got on. And I'll turn it over to you for our report on the big virus problem.
All right. Chairman, Vice Chairman, Commissioners, thank you for your time to allow me to brief you today. I assume everyone can hear me okay?
Yes.
Okay. First, I want to thank the public health staff and our partners who are busy working together to respond to this COVID-19 pandemic. The data that we're seeing is encouraging. Staying at home and social distancing appears to be working. As of 11 a.m. today, there were over 843,000 cases of COVID-19 and almost 47,000 deaths in the United States. There's 7,608 cases in North Carolina in 93 counties, and there are 253 deaths in the state. There have been 143 laboratory confirmed cases in Forsyth County, and 107 cases have been resolved, and there have been 5 deaths. As of April the 19th, 1,968 tests for COVID-19 have been conducted in Forsyth County. 44% of Forsyth County cases are in persons under 45 years of age. And as I stated last week, we are concerned that young adults may have few symptoms or no symptoms and spread COVID-19 to those at highest risk. 33% of cases, are in individuals between 45 and 64 years of age, and 23% of cases are 65 and over. Our rate of cases per 100,000 is 34, compared to 64 per 100,000 across North Carolina. In our data, race and ethnicity is broken down the following way. 23% of cases are African American, 9% of cases are Hispanic, 62% of cases are white, with 6% unknown. We are continuing to work with our local partners to ensure that we are prepared and are responding appropriately. I want to remind the public there are undiagnosed cases of COVID-19 since we have community transmission. People may be transmitting the virus to others without knowing it. And please continue to stay the course and stay at home and practice social distancing. Some questions that have come up recently are about cloth masks. The CDC advises the use of a simple cloth face covering to slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. Residents should wear a cloth face covering when they go out to do essential activities like grocery shopping. It can be store-bought or it can be a homemade mask. They should also continue to practice social distancing and stay home if they think they're sick. Cloth face coverings do not replace other preventive measures like staying at home, washing your hands, and staying 6 feet away from others. In closing, again, I want to remind everyone that COVID-19 is highly contagious. People who are infected can have the virus for days before showing symptoms, and some will never have symptoms. So you could feel fine and yet be bringing COVID-19 into your home, to your loved ones, without knowing it. I appreciate your time, and I'm open now for questions.
Mr. Swift, any comments or questions from the commissioners for Joshua? Obviously, we have no questions right now. Thank you for that report. Appreciate it very much.
Thank you.
I will mention that the governor is going to have a task force meeting on television at 3 o'clock this afternoon, and we should be through with this meeting very close to 3 o'clock, but that's 3 o'clock this afternoon from the governor's office in Raleigh. Now I'd like to switch to Commissioner Gloria Whisenhunt. As many of you probably know, we as a board decided to go along enthusiastically with the suggestion by Mrs. Whisenhunt. She was concerned about the problems and needs related to the opening of various facilities in Forsyth County. Mrs. Whisenhunt, you had a meeting, I think, with the Mayor of Winston-Salem and some of our commissioners. What happened?
Thank you, Mr. Chairman. First, I'd like to talk about our Commissioner Ad Hoc Committee, which consists of Commissioner Kaplan, Commissioner Elamine, and myself, and we have met twice this week, along with the manager and assistant manager and the county attorney. Am I not on?
Yes, you're on. Keep going.
Yesterday, Dr. O joined us to provide his recommendations regarding reopening business and social life in the county. To reopen, Dr. O said we needed to meet 4 criteria: 14 days of low declining COVID-19 case counts, widespread testing capacities, contact tracing for all patients testing positive, and enhanced isolation and quarantine programs. The good news is that we are well on our way with the testing, the contact tracing, and the isolation and quarantine orders. Forsyth County Public Health Department is practicing contact tracing on all positive COVID-19 patients, and I think that we should all be so proud of what our Forsyth County Public Health Department is doing for us and has kept our numbers low. We haven't yet reached the 14 days of declining case counts. This standard was announced by the White House and approved by the CDC. The county and city of Winston-Salem have proposed forming a joint reopening task force so that we may have a uniform reopening of business. As the CDC recommends, the opening will be in phases, with businesses that can practice social distancing reopening first. The governor's current stay-at-home order expires next week, and as you've just heard, the governor will today at 3 o'clock make an announcement about his plans. With Dr. O's guidance, we will review this new order and determine how to proceed with our phased reopening. Dr. O, though, has warned us that if we don't wait for the 14 days of declining cases, and if we do not practice the social distancing, we'll have to close business again in the future. And we are committed to reopening the county safely as soon as possible. Therefore, the committee has recommended that we move forward with the reopening task force and that it will include all of our municipalities. The governor has indicated that local communities have a voice and a role in the effort to reopen and return to normalcy. As such, the Ad Hoc Committee will play a key role in aligning the needs of our community with state regulations. This committee, this countywide committee, task force committee, we could be act as an advocacy role and a regulation role. The advocacy for less restrictive measures were appropriate given the success that Forsyth County has experienced in limiting the spread to date and potentially enacting additional regulations that may be critical to ensuring that the community remains safe. Much of this depends on what Governor Cooper has to say today. This committee can serve as a communication efficiently with citizens and respond quickly to regulatory changes coming from the state. Working together as a county and a city committee will make us much more effective than if we took action separately. The committees hope that Mayor Joines will terminate the local order to place all the county under one set of rules. And this is our report from our Ad Hoc Committee, and I thank Commissioner Alameen and Commissioner Kaplan and our staff for guiding us through this. Thank you, Mr. Chairman.
Chairman Plyler, I believe you are muted, so you'll need to cut your microphone back on.
Thank you very much, Mr. County Manager. Turn the meeting over to you.
Chairman Plyler, before you do that, can I make a few comments about the report from the Ad Hoc Committee, please?
By all means. Yes, ma'am. Go right ahead.
Thank you. Gloria, you guys have done a tremendous job on this reporting. One of the suggestions that I would like to be able for us to vet out is with regards to the widespread testing. What does that look like? Joshua shared with us that about 1,000, maybe 1,100 tests have been provided throughout Forsyth County, and we know that we have over 600 constituents here, 600,000 constituents in Forsyth County. So being that, I'll move to the tracing. And although that we're getting the data regarding the ages the ages and the percentages of those individuals involved with the testing and who may be positive, I would like to also delve a little bit more into the races. And I know that we have to, keep the patient's information confidentiality with regards to HIPAA. However, I think that we could still drill out a little bit more with regards to the African Americans or Hispanic and whites and the unknowns, the percentages of those ages, of those of the ethnicities. So, and I'm saying that because I wanted to make sure that we have funding and those resources are available in those areas with regards to the ethnicities and the ages. So it's not to say where someone lives, but just where we need to start putting those resources. So those would be my recommendations, and thanks for allowing me to share.
Thank you, Commissioner McDaniel. Any further questions, comments? We'll turn the meeting now over to our County Manager, Dudley Watts.
Okay, thank you, Mr. Chairman. Good afternoon, board members and staff who are on the line, and also our viewing public. So basically what we have is we have the efforts to finalize the items for the Thursday, May 7th formal meeting. As the chairman said, we will not have a briefing or a meeting next Thursday, as it's a fifth Thursday in the month, and so we'll it'll be a couple weeks, and it'll give us a chance to learn a little bit more about where we are with the COVID virus and all that kind of stuff. So without further ado, I'll go ahead and just introduce and see if there are any questions about the agenda items for that Thursday, May 7th meeting. The first item is a resolution recognizing May 2020 as Foster Care Awareness Month in Forsyth County. John Thacker will be here with DSS to receive that resolution of recognition. Item 2 are the minutes for the meetings of March 19th, 2020, April 2nd, 2020, and April 16th, 2020. And Madam Clerk, have those been sent out to the board?
Yes, sir, they have.
Okay, thank you. So you'll have those for review. Item 3 is the public session. Item 4 is a resolution authorizing the acceptance of grant funds from the North Carolina Division of Soil and Water Conservation under the Hurricane Florence Emergency Response Act for a watershed restoration project. Janice Hillenbrand from our budget office reviewed that last Thursday, and she or someone is on the line if you have any questions.
Comments, questions? Okay.
All right. Item 5 is a resolution authorizing execution of an engagement letter and audit contract with Elliott Davis PLLC to complete the annual independent audit for Forsyth County for fiscal year 2019-2020, subject to approval by the Secretary of the Local Government Commission. That was presented last Thursday, and Paul Fulton or someone from the Finance Office is on the line if you have questions.
Questions or comments? Okay.
Item 6 is a resolution approving the purchase of a communications recording system for the backup 911 communications center. Herb Swain, our 911 director, reviewed that last Thursday, and he's on the line if you have questions.
Comments? Questions? Okay.
Very good. Item 7 is a resolution awarding a contract for the purchase of a law enforcement detention center specialized mail screening system. That was carried over from the prior agenda, and we did have the vendor of that system make a presentation that was available and had several commissioners who attended that this week. And so I don't know if there's any comments from any commissioners who were there and participated in that. And Randy Hunsucker and Major Slater from the Sheriff's Department are on the line if you have any questions.
Just a comment, Dudley. Mr. Chairman. Yeah, I really appreciate the presentation that he made because it made it a little more crystal clear the capacity we would have for security at our detention center. So I just want to thank the gentleman for making the presentation available, and thank the staff over there for being available for questions during the presentation.
Further questions? Comments?
This is Don. I'll just echo Commissioner Elamine's thanks to the both to the Sheriff's Department staff for actually having the vendor. It was a lot clearer what the issues were and what the needs were. I probably still, generally speaking, I am convinced it is a tool worthy of having. And the fact that there's SCAP funds available makes me more inclined to be supportive. However, it does appear that the North Carolina prison systems do not use them. It is not on their radar. There is no other county in North Carolina that's using them. And there's still no competition for this firm. Now, I think this company seems to be very good. They have 39 installations across 15 states. No one has refused and turned them back in. 85% of them take the maintenance contract. They're all still in operation, and apparently this particular screening at the moment is unique. I feel pretty sure in the future that there will be competition for that, and I think, as I have expressed on numerous occasions about numerous issues, particularly competition is very important in terms of getting what you see good buys, plus a good track rate. If something comes out half price that's newer and greater, in 2 years, we'll be here, we will have spent this money. Of course, I do agree with the Sheriff's Office that during the time you're waiting, there are going to be X number of incidents where both inmates and or staff can be subject to potential harm. At this point, there have clearly been a couple that we're aware of that have been cases where people had to go to the hospital, but I think it's a matter of just priorities versus that risk. So, but it was very helpful, and it was a balanced presentation, and I thought the company rep did a very good job of presenting the information and answering questions.
Additional comments? Okay, thank you very much.
All right. Agenda item 8 is a resolution awarding and authorizing the execution of a contract for janitorial services for designated Forsyth County facilities. General Services submitted this, and Kirby Robinson presented. He's on the line if anybody has any questions.
Questions, comments? Okay, thank you.
All right. Agenda item 9 and 10 are very similar. They are resolutions authorizing the grant and execution of temporary license agreements to folks that own property in and around C.G. Hill Memorial Park in Pofftown. Chelsea Swain reviewed those. These really are part of the woodland management work that we're doing out there, where some of the local, those adjacent property owners wanted to participate, and this would allow them to take their timber out using the same access road that we have.
Comments? Okay.
Great, thank you. You've got several reports. You've got the Human Resources Report for the month of September 2020. There's also a budget in project report, and there were several questions about that report, and I will turn it over to Dan Cornelis in Housing and Community Development. Dan, are you on the line? Dan, you might be muted.
Hi, good afternoon. I did get the memo that was there's some questions at the last board meeting about a line item in the budget in status report that was dated April 13th. The line item was a loan repayment to JW